Well, thank you all for coming today, and it's such a nice day, outside. I appreciate you're all taking time to be indoors and not enjoying the nice outside sunshine. We're going to be talking about hyperbaric oxygen therapy today, and it may be a subject that you may not be particularly familiar with. How many of you have ever heard of hyperbaric oxygen therapy? Okay, so a fair number of you have, and we'll talk a little bit about some of the medical uses for this. Okay, so the talk today, we're going to talk a little bit about what exactly hyperbaric oxygen therapy is. We'll go through the physiology, the science of why it works. We'll talk about some of the conditions that it's used for treating, including severe untreated anemia, diabetic foot wounds, radiation-induced tissue damage, carbon monoxide injury, central retinal artery occlusion, and decompression injuries. Our facility, and this is a picture of our facility, was opened in 1997. It's a multi-place facility. We can treat up to 18 patients at a time, and we have 2 wings to the chamber, so we can use 2 different pressures if we need to, depending on the patient's condition. We treat, we're the second highest facility in the United States in terms of the number of patients we treat per year. I'm not sure the pointer's working this well. I think we're going to give up on the pointer, and I'll just do a page down here. Okay, so hyperbaric oxygen therapy is the administration of oxygen under pressure. And you have to have a minimum pressure. The pressure that our body is sensing right now at sea level is 1 atmosphere. It's an arbitrary number, but it's basically the amount of pressure that the atmosphere is putting on our body here while we're at the surface of Earth. So for hyperbaric oxygen, you have to have the pressure higher than that, and it has to be above 1.4 times the pressure that we are sensing at the surface for it to be considered hyperbaric oxygen. Anything less is not considered hyperbaric oxygen therapy. So what happens is we have the hyperbaric chamber. The patients go in the chamber. This is the door to one of the chambers. And we have a technician who sits outside and controls the pressure. The most common pressure that we use is 2.21 atmospheres, which is equal to 40 feet of seawater if you were scuba diving. So you would be down 40 feet underwater. And that gives you oxygen that's several hundred times more than your body normally would get.
Are there any windows in that thing?
Yes, they're little peepholes. It's sort of like a submarine. Let me go back there. Okay, so this is a window there, okay? And on this one, this is a window there. There's usually...
You can go in there if you're a little bit claustrophobic, you can see out.
It's a small room. It's not that tiny, and there'll be there's at least a technician in with you, and there may be other patients, so that you can read a book. We don't allow any electronic devices in the chamber, but people do Sudokus, that kind of thing. It's not, some people have a little bit of concern about it ahead of time, but most people tolerate it very well. So hyperbaric oxygen works in several different ways. One is, of course, anytime you put your body under pressure, it's going to put pressure on everything in your body, including if you have little bubbles. And that's particularly useful if you have like an air bubble blocking the circulation in your brain or in another part of your body. So just shrinking the bubble is one of the benefits of hyperbaric oxygen therapy. The other thing that it does is it causes a constriction of the blood vessels, so you have a decreased edema. And one of the most common causes of wounds in the leg is swelling. As we all get older, we all tend to have more swelling or edema in our legs. And the circulation around the ankle is a particularly weak part of our circulation. And if you have a bruise or an injury there, it's very easy for that skin to break down. And it's very difficult for those wounds to heal up unless you can shrink the edema. So that's one of the other benefits of hyperbaric oxygen therapy. And then the third is that it increases oxygen in the tissues. In addition to having oxygen attached to your red blood cells, it will have oxygen that's dissolved several hundred times more in the plasma in the blood, in addition to the oxygen that's attached to the red blood cells. And that's enough oxygen, so even if you didn't have any red blood cells, you could stay alive with just the oxygen in the plasma for several hours. So it is a very strong effect that hyperbaric oxygen has. And because oxygen increased in the tissues causes increased oxygen so that your cells can continue to work, because we all need oxygen for our cells to perform their normal functions of metabolism and cell repair. But it also helps to cause new blood vessels, little teeny weeny capillaries, to grow into areas, for instance wounds that don't have any capillaries in them, to allow them to start to heal. It also increases the amount of collagen that is put into a wound, and it increases the effect of antibiotics and kills some bacteria. So these are all multiple ways in which hyperbaric oxygen works. It's not just one single modality. Okay, so hyperbaric oxygen can sometimes be confused with another type of oxygen system that is also, has been in the past, heavily promoted and advertised. And that's regional oxygen therapy, where if you have a wound, you have a container that is tight-fitting, and then oxygen is pumped into that area. This is not hyperbaric oxygen, and it's not as effective as hyperbaric oxygen therapy. This is not FDA approved for wound healing. Some of the things that we're going to be talking about today are on this list here. So there'll be untreated anemia, problem wounds, delayed radiation injury, chronic infections of the bones. If you have an air or gas embolism, such as in decompression sickness from scuba diving accidents, carbon monoxide poisoning. We won't be talking much about severe infections, but that's another indication that we have for hyperbaric oxygen, and central retinal artery occlusion, which is a stroke in the brain, in the eye. Okay, so this is a slide which shows how the hyperbaric oxygen works. So if you have a blood vessel and you have an air bubble in it, then the hyperbaric oxygen, as it's applied, will shrink that bubble and allow circulation to occur around the bubble. Most of the effect that we use most often is not shrinking bubbles. That's really just for accidents such as scuba diving accidents or air embolism, but is to increase the oxygen in the blood in addition to what's attached onto the red blood cell. And that's the most effective way that wound healing occurs. So let's talk a little bit about the air, okay? The air we normally breathe here at sea level is about 78% filled with nitrogen and 21% filled with oxygen. Now, oxygen is absorbed into your tissues because your body uses oxygen. If you say get an air bubble of oxygen, pure oxygen into your bloodstream, it doesn't cause any problems at all because it's absorbed very quickly. So it's unlikely to cause permanent damage. However, if you have a bubble that has some oxygen and some nitrogen, nitrogen is not absorbed in your body, and it will sit around there for days to weeks, and it can cause damage. So one of the things that hyperbaric oxygen does is not only shrink those bubbles, but it helps the nitrogen to diffuse out and be replaced by oxygen, which your body then uses quickly. So those are some of the ways that hyperbaric oxygen helps with air emboli. Now this has a few little, we're going to get all the animation out here first. Okay, so this is a slide which shows you that at the surface you have 1 atmosphere of pressure. At 40 feet underwater you have 2 atmospheres of pressure. And then this is around 60 feet underwater, have 3 atmospheres of pressure. So every time you go underwater, you're increasing your pressure on your body. So and when a scuba diver goes scuba diving, they have increased pressure on their body. And they're breathing air with their portable underwater air system. So the air that then is getting into their body at 3 atmospheres, when they come back up to the surface, if there are any bubbles anywhere, those bubbles are going to expand because there's less pressure keeping them a certain size. And that's why people who have scuba, get air into their bones or their joints, can have what we call the bends when they come up to surface if they're not very careful and do what we call decompression stops and try to get all the excess nitrogen out of their body before they come up to the surface. Okay, so the mechanism we've talked about so far is that you can improve the circulation in areas where there's no circulation. We also, hyperbaric oxygen has an effect on infection and inflammation, and it also helps the collagen in the new capillaries to form in wound healing. So there are some immediate effects and there's some late effects. This is, now I'm going to let you know ahead of time. Some of these pictures are a little graphic, so if it makes you uncomfortable, you can close your eyes. So this is the first set. This was a premature infant who was born and had a vascular compromise to the right leg, resulting in gangrene of the right forefoot there, as you can see. But with the nursing staff in the ICU were able to identify this early on, and we were able to perform hyperbaric oxygen therapy, and we were able to make significant progress in decreasing the amount of permanent damage the patient's foot had, so that we were actually able to salvage most of the foot on the infant. And this is a picture of someone who's had a graft done after they had a severe injury to the top of their foot. And with hyperbaric oxygen therapy, you can see how well that healed up. This is another picture of someone who, this is more of a wound healing picture. This is a diabetic patient who is also a kidney transplant patient, so he's on immunosuppressive medicines which keep wounds from healing. He had already had an amputation of his forefoot. He had had some sort of a cast or boot that he was using that caused an injury to the top of his foot, and it did not heal. You can see the tendons here are exposed, but with hyperbaric oxygen therapy, you can see we were able to cover up all the tendons, and since this picture was taken, the wound is completely healed over and the skin is healed over. Wow. So we were able to provide that, and that allowed him to continue to be able to walk rather than having an amputation and be wheelchair bound for the rest of his life. Okay. So hyperbaric oxygen goes through different parts of your body to get to the tissues, and we'll just review this. So you start out with, if you're breathing 100% oxygen by, say, an oxygen mask at the surface, that will be go into your lungs, into the air sacs, and that's called alveolar air. The air then goes through very thin membranes in your lungs and gets into the pulmonary capillaries. The blood then transfers into the pulmonary veins through your circulation. It passes through the heart, goes into the heart, pumps it into the arteries and the rest of your body, goes to the capillaries and all your organs, and ends up in the fluid around the cells and in the cells. And within the cells, then oxygen is used in the endoplasmic reticulum and the mitochondria to be able to provide energy to the cells for the cells to function.
You think it would be exhausted by the time it went down?
Well, it's a pretty impressive thing, that's for sure. And this is just a little picture of that. Okay. One of the other ways that this is actually a study that was done that shows that hyperbaric oxygen allows formation of new blood vessels. Now what happens is these were patients who had radiation wounds that weren't healing, and they were started on hyperbaric oxygen at about this point. And you can see that the oxygen tension in the area around the wound was measured, and it was very low. Anything below 40 means that your wound's not going to be able to heal. Your tissues need at least an oxygen tension of 40 to be able to heal wounds. And as we did about 20 hyperbaric oxygen treatments, you can see the oxygen in the tissue started to improve and new blood vessels were being formed. So it takes about 20 treatments for a radiated wound.
This radiation, where do they get this radiation from?
Well, we'll talk a little bit more about that with some later slides, but anyone who's had cancer, about half of cancer patients have radiation therapy as part of their treatment for their cancer. We'll talk first about severe anemia. So normally our hemoglobin, as we mentioned, in the red blood cells is how oxygen gets into our tissues. However, if you're anemic, your body's not going to be able to receive as much oxygen to the various organs. This, of course, can end up causing damage. The two organs that are probably the most sensitive are the heart and the brain, but the kidney is also a sensitive organ. Your skin's not quite so sensitive. Your skin can deal with low oxygen levels for a little bit longer than most of the other organs. And of course, transfusion is our standard treatment for that.
Is this a good time to ask you a question about anemia? You're going to go about it. We're going to talk about it more later.
Anemia is now.
Oh.
Go ahead.
No, thank you. So how do you know, like they say when they take the blood test whether you're anemic or not? And I've been trying to take B12, it doesn't help a lot. Plus I have small fiber neuropathy. Do you know what that is?
Mm-hmm.
That's where the capillaries aren't getting enough oxygen and stuff, and so then the nerves die off, and then I'm all numb.
Mm-hmm.
No pain, but just numb. Blah 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 blah. So would this do something for that, or?
Well, the amount of, usually we don't use hyperbaric oxygen therapy for a mild anemia or a neuropathy unless there's a wound associated with the neuropathy. So in a severe case where there was a wound, it would very possibly be used. But if you don't have an open wound, it probably would not be used at this point in time.
They have researched that for that.
The thinking is that there are other treatments which are beneficial, and there's been no proof that hyperbaric oxygen will cure the neuropathy.
I see.
And this is the effect of the hyperbaric oxygen lasts about 6 hours. So for someone who has a severe anemia, they have to have a hyperbaric treatment 2 or 3 times a day. Well, if you don't have until the other treatments for the anemia can be addressed, either transfusion or stopping whatever's bleeding or whatever. So for someone who has a chronic mild anemia, it would be prohibitive because you'd basically be in the hyperbaric unit all day, every day for the rest of your life. So it wouldn't be a very reasonable treatment. Question?
Thank you for clarifying that.
What numbers are considered severe anemia?
It depends on the patient and the organs that are under strain. We used to transfuse patients to a hemoglobin of around 10 if they were ill. Okay, nowadays we've learned that transfusions themselves carry certain health risks and side effects. So if someone's perfectly healthy and not having any side effects, we don't transfuse them unless their hemoglobin is less than 7 now. So some patients have religious reasons for not getting a transfusion, and sometimes also we can't locate compatible blood. So those are the most common applications today for hyperbaric oxygen therapy for severe untreated anemia. And as we mentioned, hyperbaric oxygen therapy increases the amount of dissolved oxygen in your tissues, which then allows your tissues to get enough oxygen until the underlying treatment problem causing the anemia is cured. For instance, one of our patients at UCLA a year or so ago was a Jehovah's Witness. She had a bleeding ulcer, and the surgeons were reluctant to put her under anesthesia to sew up the ulcer because her hemoglobin was only 5. So they agreed to do the surgery, but only after we started her on hyperbaric oxygen treatments, and then they did the surgery in between treatments so that they were sure that she was getting enough oxygen to her tissues during the surgery. We'll talk a little bit more about problem wounds, and I've alluded to this as an application for hyperbaric oxygen therapy earlier in the talk. So problem wounds are a big expense to our healthcare system, and it's increasing as our population grows older. As we talked about, the venous insufficiency wounds are probably the most common cause, and sometimes just getting the edema that's associated with these under control will help these wounds to heal. However, diabetic foot wounds are also a serious problem in terms of wounds in the healthcare system. And over half of the amputations that are done in the United States are done on diabetics who have foot wounds that haven't healed and are at risk for infection. If you have an open wound on your skin, the reason it's a concern is because that allows bacteria to get into your body and increases your risk for infection. And if you get an infection from a wound into your bloodstream, you have about a 30% chance of dying from that. So it's a significant potential problem. And that's one of the reasons why our healthcare system is very interested in getting wounds to heal up on patients. Any wound that has a tissue oxygen level of less than 40, and it turns out most of them do, if they're not healing within 2 weeks, are wounds that will probably not heal no matter what else you do without additional oxygen. What causes wounds? Okay, so there are several different things. One is you can cut yourself and have bleeding. You can have a pressure, an area of pressure, for instance, a diabetic who has a neuropathy in their feet. The shape of their feet actually changes with the neuropathy, and they're putting pressure on different parts of the foot where the bone is not well protected or well cushioned, and that can result in a wound. You can have problems with the circulation. Many people who are cigarette smokers may have what we call peripheral arterial disease, and if that affects the leg arteries, that can cause a wound. If you bump yourself by accident, you can end up with a wound that won't heal. If you have a problem with your immune system, I mentioned there was the gentleman who had the kidney transplant. He may be on immunosuppressive drugs or just may have a condition such as AIDS, which it suppresses your immune system. That keeps wounds from healing too, because it allows the bacteria to continue to grow in the wound, and a wound that is filled with bacteria will never be able to heal because the bacteria are eating up any new tissue that's being formed. And if you have a wound, it may actually be a sign of cancer. So if you have a wound that won't heal on your skin and it hasn't healed for several weeks, you ought to make sure that you have your doctor check it, because it could be an early skin cancer. Some additional things that can contribute to problem wounds. We talked about diabetes. Anyone who has a connective tissue disease, such as lupus or mixed connective tissue disease, any of those are all have problems with the circulation in the microscopic area of the skin and can increase the risk for wounds. If you don't eat well, if you have any kind of a vitamin deficiency for whatever reason, and we all think we eat healthy, but some of us still may have some vitamin deficiencies. For instance, people who are alcoholic will frequently not have enough of the B vitamins in their system. They're at increased risk for wounds. You may have someone who is Munchausen syndrome. Is a condition where the patient is actually injuring themselves secretly in order to be able to have contact with the healthcare system. And so there are some patients who actually injure themselves, and that may be a cause of a wound. And you may have a reaction to a medication. If you get a bad rash from a drug reaction from a medication, you can end up with having, if you scratch your skin enough, some of them may end up with open wounds. How do we prevent wounds? Well, you want to prevent pressure, okay? You want to keep anyone who has a tendency to fall, could injure themselves and end up with a wound, so you want to minimize any falls that patients have. You want diabetics who may not, because of neuropathy that so many diabetics have, they may not even be aware of the fact that they have a sore on their foot. They need to have regular checks by their doctors. When you go to see your doctor, if they say, I want to take a look at your feet, don't be surprised. Okay, we want to make sure that anyone who's willing to stop smoking does, because smoking increases the amount of carbon monoxide in your body, which means that part of your body is not getting as much oxygen as it otherwise would, because carbon monoxide competes with oxygen for the being on the red blood cell. And anyone who has high cholesterol, you want to treat that, because that can contribute to blockage of the arteries. Adequate nutrition, okay, probably most of us don't eat enough protein. And you want to do some regular exercise, because that helps the lymph system and the circulation to help keep your body from developing circulatory problems. And any other health problem that you have, you want to make sure you try to treat that and address it appropriately. So wounds normally go through an orderly phase of healing, okay? So the first thing that you want to do is if there's any contamination, like for instance, if you fall and you say on some gravel and you get an abrasion on your leg and there's dirt that's in the wound, you want to wash that off and clean it. And most of us do that automatically. We want to get rid of any contamination, because all that foreign material is a setup for infection. The next phase then is, and what happens is your body's natural reaction to an open sore is to have the inflammatory cells, such as white blood cells, go into the area and clean up any bacteria or any foreign items that are still left there. And that's called inflammation. Initially, that's very beneficial, but if it continues on, it can keep the wound from healing. So you're hoping that the wound transitions into developing new tissue, and part of the skin is connective tissue, and if you don't have connective tissue as sort of like a matrix, the normal skin can't grow back on top of it. So you want to have your connective tissue recreated, and then you need new blood vessels growing into the area so that it will survive on its own. And finally, you want to have nice skin and minimize scar tissue that you have to cover the surface. All of these phases require adequate circulation and oxygen for them to proceed normally and allow the wound to heal. Let's talk about time frame. Okay, so stopping bleeding, usually it just takes a few minutes. If it takes longer than that, or if it's not stopping, you usually go to emergency or contact your doctor. Usually pressure will solve the bleeding issue right away on minor wounds. The inflammatory process usually takes between 1 and 4 days, and then the healing process may take up to 3 weeks. Okay, I don't know if you can remember the last time you had a bad cut or a bad abrasion, how long did it take it to heal, but it was probably a week or two. And it's very interesting, but remodeling of the wound may take up to 2 years. So when you have a surgeon do surgery on you, and they say no heavy lifting for 6 weeks, it's because the wound, even though it's sealed up, you know, there's a little bit of scar tissue there, that scar tissue is still remodeling and strengthening for up to 2 years. So we have to be very sensitive to the fact that the wounds aren't totally strong within the first day or two of the wound healing. How do we predict whether or not a wound is healing normally and is going to heal on its own? Usually, if it's decreased in size by about 20% within 2 weeks, it will be successful in healing on its own. And you should be able to see about a 40% reduction in the size of the wound at 4 weeks. So if you have a wound that really hasn't made any progress at all in terms of healing in a month, it's probably not going to heal on its own. And those would be the wounds that might be helped with hyperbaric oxygen therapy. There was a study done of diabetics, and in this study it showed that if you could decrease the size of the wound by 50% at 4 weeks, that most of those wounds would heal within 3 months. So again, the 4-week cutoff is sort of generally accepted now as the point at which to consider hyperbaric oxygen therapy. A wound becomes chronic, as we mentioned, because you may not have enough growth factors, you may not have enough vitamins in your system to have the growth factors you need to heal the wound. There may be too much bacteria in the wound, there may not be enough oxygen. It may be that the cells around the wound are just too old and they're not going to, you may need new stem cells to go into the wound to heal up. And it may just be that they're multiplying and migrating too slowly for it to heal within a reasonable period of time. We've talked about all of these. So for instance, with a diabetic, one of the important things is if they have a wound on their foot is to take the pressure off the area of the wound and to make sure that if they're walking on their foot that they're not continuing to traumatize the area. Diabetes. Diabetes is a big problem for our society. It turns out that about 8.3% of the US population has diabetes. That's over 18.8 million people who've been diagnosed, but we still have a fair number of patients who have not been diagnosed. And that will continue to increase because type 2 diabetes does increase as people age. That's one of the risk factors. So if you look at a map of the United States, you say, okay, well, here we are in Southern California, and we're about at the national average for diabetes, around 8% here in Los Angeles. So we're sort of typical. The reason we're concerned about diabetes and wounds in diabetics is because most of the people who have amputations are people who have diabetes, and it's a fairly large number of people. It turns out if someone has an amputation for a wound that wouldn't heal, about 50% of those patients will die within 5 years. So definitely an amputation shortens one's lifespan. Plus, they usually end up having recurrent hospitalizations and surgeries. It's not unusual for an amputation site to have difficulty healing. So this is a significant issue for our healthcare system as well as for the individual patients who it affects. And by the year 2000, and I think that's supposed to be 20, the slide's off, there should be 1 in 3 Americans.
Born in 2000.
Oh, born in 2000, okay, got it. Thank you, you're reading it better than I am. So we're hoping to find ways of reversing this trend, but it is a serious trend.
It's a poem. And that's mostly coming from pressure on the foot?
Well, the wounds, pressure, or if they have a neuropathy, they may have an injury and not realize it. You can bump your foot and not even be aware of it. So when you talk about the costs, it's a big healthcare expenditure. So if we can somehow help to manage this better, it'll be a big help, because right now, as you know, the Medicare healthcare budget is sort of straining, and we're all looking for ways we can try to help with that.
So what's the cost of the hyperbaric?
I have a slide on that, but one hyperbaric treatment is about the same cost as a transfusion of 1 unit of blood. Now, hyperbaric oxygen therapy for wound healing usually requires between 20 and 40 treatments. So it's not a small amount of money, it's a significant amount of money. But if you look at 1 day in the hospital, if you've ever had a bill, it's not unusual to have a bill for something like $20,000, $30,000 for 1 day in the hospital. So if you can somehow prevent people from getting infections that require hospitalization from these wounds, you're saving, when you look at the big picture, you're saving the healthcare dollar.
Does Medicare pay for that if it's going to identify it as something that's necessary to keep your limbs or whatever?
Medicare covers hyperbaric oxygen therapy for problem wounds that won't heal, particularly in diabetics. And they have a list of conditions and so forth, so that you can know pretty much ahead of time whether or not Medicare would cover a specific treatment. So the patients that are diabetic, if it looks like they may end up having to have an amputation, in the near future because the wound's not healing, that would be a reason to treat them. The Wagner staging system is an objective staging system describing how deep the wound is, and a Wagner stage 3 is one that's near the bone. Okay, so in a foot it's not too difficult to get near a bone, and those are considered appropriate for hyperbaric oxygen therapy. And we also talked about if a wound has failed standard care, which involves these 3 items, as well as antibiotics if needed, that for over 30 days would also be considered. There have been a lot of, when you say, okay, well, what's the evidence for hyperbaric oxygen therapy for wounds? This is a series of 6 studies that have been done on diabetic foot wounds to see whether or not hyperbaric oxygen therapy actually helped heal the wounds. And the orange is the number of, the measuring here is the number of amputations that occurred in either the control side of the study or the hyperbaric side of the study. And you can see in all of these studies that have been done, multiple facilities over several years, there's been a decrease in amputations that occurred in these patients if they received hyperbaric oxygen therapy in all but 1 study. And in this study, the amputation rate was very low in both sides. So we do feel that there's significant medical evidence that shows that hyperbaric oxygen therapy is an effective treatment for diabetic foot wounds that are not otherwise healing. This is another set of studies that were done to see whether or not the ulcers would heal, not just whether or not there was an amputation that occurred, but were we actually able to get the whole wound to heal. And as you can see, the percentage of wound healing was much greater in all the studies with the hyperbaric oxygen patients compared to the controls, which are in gray.
How come some studies there wasn't so much over at the end? What went on there?
This,
Yeah.
there was an increase, pretty high, in the hyperbaric. There was also a pretty good increase in the control, okay? So, but the difference between these two is still statistically significant. Each one of these studies have different types of patients, and so there is some variation within the studies, but that's why you do multiple studies, so that, I mean, because if you looked at just one study, this study, you might say, oh, gee, it looks really good.
My question is, what kind of study was the one where there were so many that didn't respond? What was there?
You mean this one here?
The third one over, the last one over. Why-
This one?
Yeah.
Okay.
Who were those people that got such a bad, I mean.
Well, 80% of them had their wound
Yeah,
healed.
what was the problem with these people that they didn't heal in the first place?
The controls,
Yeah.
they probably had a variety of problems. Okay, so each study, anyone who is diabetic will have low oxygen in their around the wound, so that would contribute to it. They may have had difficulty controlling their diabetes. If their blood sugars were poorly controlled, that decreases the ability of white cells to function normally. Some of them may have had more infection than others. Some of them may not have had as good nutrition as others. So between the studies, there was not, you know, those things were not matched in the two groups. They were matched in the two groups within each study. So in some studies, you'll have good results or relatively good results with standard care, but if you have a significant increase with the hyperbaric oxygen, it's still considered a positive effect. Does that help to answer that?
No, but
Oh,
thank you.
okay. Okay, and this is the most recent study that's been done, and you can, go to Diabetes Care, which is available on the internet if you want to, and you can read about the study in more detail. We're going to talk about delayed radiation wounds next. Okay, so over 1 million people in the United States have been diagnosed with cancer of all different types, and in 2010, 1.5 million men and women will be newly diagnosed. And of those, approximately half of them will be receiving radiation therapy as part of their treatment. We now know that delayed effects of radiation occur in about 5% of patients. And these are things that develop several months after the radiation therapy is completed. When you're having radiation therapy, you may have several acute effects that eventually heal up on their own. You may have some hair loss, you may have a dry mouth if you're having radiation to your chest or your head and neck. You may have pain in the abdomen or pelvic area if you're having radiation to that area. Those acute changes usually heal up quite quickly once the radiation is stopped. However, we now also know that there are some delayed effects on tissues that have been radiated that may develop 6 months or longer out. Some of them don't develop for as long as 30 years.
If it's 30 years, can they prove that it was 30 from radiation?
The changes that you see in the wounds are classical for radiation. So if a biopsy is done, or a lot of times the doctor will just look, and if the tissues, have the appearance that you see due to delayed radiation damage, that's how the diagnosis is made. So the time onset may be between 6 months and several years, and it may be a wound that you can see that won't heal, and it doesn't heal. And one of the classic things that you can see is it doesn't bleed a lot. Okay, so a radiation wound usually is sort of very pale and doesn't bleed a lot. The only exception to that is if you have radiation damage to the colon or the bladder, you can get bleeding as a result of that because the mucous membranes have been damaged, and it allows the capillaries in those organs to bleed. We now know also that patients have a different susceptibility to radiation. So a radiation dose that we give to one patient may not cause any problems for that patient, but to another patient, it might. And we're still in the process of trying to figure out genetically what those differences are, so we can predict and make adjustments in the initial treatment for radiation. But we're not quite there yet. We can't predict who's going to end up with radiation damage and who isn't at this time. Also, different tissues react differently. So the areas that we see most problematic are patients who've had head and neck radiation, patients who've had radiation, say, for breast cancer. If they have surgery in that area, it's very difficult for those wounds to heal sometimes. And then in the pelvic area, where I mentioned radiation proctitis or radiation cystitis can be very disabling. The symptoms that you might have is in the head and neck area. You may have, if you have your jaw has been radiated and then you have to have dental work done, you may have, it's not unusual to have teeth that develop cavities more easily after they've been radiated, or even that the roots die and you have to have the whole tooth removed. And those wounds do not heal after that kind of surgery very well if the area's been radiated. So pretty much the standard of care now is to provide a patient who has had radiation to the jaw area with hyperbaric oxygen therapy for a certain number of treatments before their surgery and then a certain number of treatments after their surgery to prevent the problem from developing in the first place. However, some patients may not be so fortunate and they may have fistulas or actually the bones dissolved and broken as a result of the radiation and may have to have hyperbaric oxygen therapy and surgical operations to help fix those problems. In the chest area, you can have problems from radiation due to heart valve disease. You may have had, if you had breast surgery, you may have had a flap done or an implant, and those may fail several years out after you had it originally done. And you can have an open wound that doesn't heal in the chest area. And as in the pelvic area, we talked about the bloody diarrhea and chronic pain.
Couldn't they do preventive for chest at least?
The radiation you need to kill breast cancer and make sure it doesn't come back is at such a level that a certain number of patients will develop delayed radiation injury to that area. And we don't have anything we know of that can prevent it. I wish we did.
And it's a small percentage, so it's not worth hyperbaricing everybody.
Even if we have no scientific data that providing hyperbaric oxygen therapy prior or during the radiation decreases the late injury. So there's no place for it before the patient's treated for the cancer. It's only if the problem develops, and it only develops in about 5% or less of patients. So it's the minority. And when you're talking about curing your cancer, most people are willing to take that risk. Was there another hand?
Yeah, this was a question I forgot to ask you when we were on the wound.
Mm-hmm.
Does the hyperbaric treatment, does it help wounds or inflammations that are not open?
Yes, it can. Hyperbaric oxygen will accelerate any wound to healing better. So, for instance, you could have a radiation wound on the inside of your small intestine, in the mucous membrane there. You can't see it, it's not on the outside of your surface of your body, but it would help heal that up too.
So, but I mean, like, I have a severe Achilles tendonitis,
Mm-hmm.
3 years, just with inflammation will not go away.
Mm-hmm.
Would this type of treatment help with that?
It probably would help, but it's not felt to be medically necessary. Now, I have to tell you, there's a fair number of professional sports people, in sports teams that have their players, if they get like a groin injury or a muscle injury, that they have them have some hyperbaric oxygen therapy to heal it up faster because they want to get them back on the field playing quickly. That's not a medically approved approach. I'll leave it at that.
Is there somewhere you can go for non-medically approved
There are facilities. Our facility will only provide hyperbaric oxygen for medically approved diagnoses, but there are facilities, there are units in the LA area that will treat you for non-approved diagnoses.
But are they, can you trust them?
Yeah, they have doctors that are.
That's where they have the long things and you lay in them?
Yeah, a monoplace chamber where it's a clear plastic tube. That's what most of them are. We're the only multi-place chamber right here in the LA area. There's another one at UCSD, but most of the chambers that are commercially available at most facilities are monoplace chambers. It's a clear plastic tube that you lay in for your 1.5 to 2 hours of treatment.
You don't have to worry about being over-oxygenated, you know?
No, they all, I can tell you, they don't want to have any problems, none of these facilities. So as long as there's a reputable doctor, and you can research out the names of all the facilities. I would go to the Undersea Hyperbaric Medical Society website, and you can find facilities in the area. And as long as they're approved by the Hyperbaric Medical Society, I would say it would be a safe place to operate.
What did you say it was called?
Undersea Hyperbaric Medical Society. And I think their website is uhms.org. Okay, so we've done a lot of research on radiation damage and radiation wounds as well. However, a lot of doctors, cancer doctors, radiation doctors in the community are still not utilizing hyperbaric oxygen and referring their patients as well as they might. So we still have a little bit of education to do with the medical community. But it has the same benefits as treating a diabetic foot wound in that it allows new blood vessels to grow into the low oxygen areas, and it can actually help to prepare the area in case if the wound is so big that it's unlikely it's going to close within a reasonable period of time, but it will help to improve the chances of having a flap or graft cover the area successfully. The next topic is carbon monoxide poisoning. So do any of you have like a space heater that's in your house or in your mobile home or anything like that?
What's a space heater?
Well, a wall heater
I
that,
have a wall heater gas one.
yeah, okay. So I don't know if you know, but your space heaters that you have, the gas company asks that you have them, check it out at the beginning of every winter season. And one of the reasons for it is they don't want you to be at risk for carbon monoxide poisoning. Now, in spite of the fact that, most of us do have the gas company come and check out our equipment on an annual basis, there are some people who are not aware of the importance of that, and or their heater may become defective in between checks. And those situations put one at risk for carbon monoxide poisoning because a byproduct of the combustion of these is carbon monoxide. So it turns out that a fair number of patients in the United States end up with significant carbon monoxide exposure, approximately 40,000 in United States emergency rooms annually. So it's not a minor problem. Our unit ends up treating 1 to 2 patients with significant injuries on a monthly basis. So we do see a fair number of these. We've seen one of the last people that we had treated was a young college student who was living with her parents in Beverly Hills, but she was home for the holidays and she wanted to be by herself, so she asked if she could use the guest house. The guest house had a space heater. She and her dog spent the night there. It was cold in the evening, so she closed all the windows and doors, so it was basically airtight. And at 10 o'clock the next morning, when she hadn't shown up for breakfast, her mother went out and found her in a coma. She was brought to the UC, and her dog was also in a obtunded state. So they knew there was something that both of them had been exposed to. And she, of course, had a space heater to heat that self-contained unit. So she was brought to the emergency room at UCLA and we treated her, and amazingly, even though people who are usually that ill rarely completely recover, she is now back in college at UC Santa Barbara. And
The
You know,
dog lives.
the dog lived too. Yeah, dogs seem to be able to handle carbon monoxide a little bit better than humans. I'm not sure why.
Well,
Questions?
it's funny, oh, I'm sorry, it's funny because at my house, they wasn't working quite right with the, when you turn it on, it wouldn't come on, so the guy came and he found out it was illegal, way
Oh.
under code, and replaced the thing. So I've been living probably dangerously for 20 years,
Yeah.
because the landlord's cheap.
Another question?
Yes, that Garrett was my friend's daughter.
Oh, okay.
I know them.
Yeah.
But what do you think about lack of oxygen after drowning?
Well, that's a drowning injury is another serious problem, and usually if the patient has survived the drowning, you can support them with a respirator and oxygen, 100% oxygen at sea level pressure. They usually don't need hyperbaric oxygen to get enough oxygen to their tissues.
I took my daughter 200 hours outside hyperbaric oxygen.
Mm-hmm.
I see a lot of changes, but my husband bought it and I have hyperbaric oxygen at home.
Oh, how,
That's why I came here
I see,
to see what do you think?
yeah.
What pressure she has to be in there or
Well, we don't have any scientific studies on people who've had a drowning as to whether or not it's definitely needed for them to heal up. So I can't be more specific than that. The current standard of care, which is not always as successful as we would like it to be, is to provide them with 100% oxygen with a respirator. Okay, so what happens with carbon monoxide, as you know, is usually the way your body gets oxygen is because the red blood cell has oxygen attached to it. Turns out carbon monoxide attaches to the same receptor on the red blood cell, but it's 200 more times likely to attach. So it beats out any oxygen that's in the area. And then, of course, carbon monoxide cannot be used by your cells to provide normal metabolism and cell function. So you're basically asphyxiating your entire body when you get exposed to carbon monoxide. And the organs that are most susceptible to this, of course, are the heart and the brain. Fortunately, there's been some legislation passed, and it's starting to go into effect this year, I believe, but by 2013, all property owners are going to be required to install alarms. And you can buy these carbon monoxide sensors and alarms for your homes while you're waiting. I think they sell them at Home Depot and any of the other hardware stores. And those it'll be an alarm, just like a fire alarm that senses smoke in your house. This is a sensor to sense carbon monoxide, and you'll be able to pick it up. And the recommendation is to have one in the bedroom, because that's the one place where you're in a closed environment and sleeping and may not be aware if you're starting to become ill.
I'm just thinking, I've already got the first smoke alarm that's still there with the batteries, as that doesn't work. Then we get the other one to plug in, now we'll have this. There's no more room in my ceiling for my...
Well, there's a lot. Hopefully, one of these days they'll combine all of them into one unit.
I'm loaded with all these things.
So carbon monoxide poisoning can cause brain damage. It can cause hearing loss. And some of this, the changes may not be immediately apparent and may take time. Some patients who get carbon monoxide poisoning may have problems with depression, months later. Hyperbaric oxygen then will push the carbon monoxide off of the hemoglobin. In other words, it gives the oxygen an extra force to be able to attach to the hemoglobin. And in addition, the dissolved oxygen that you see in hyperbaric oxygen therapy in the blood itself is enough to maintain your cell function until the carbon monoxide washes out of your system. So it's important that you try to get these patients in for treatment quickly. And that has been proven to reduce the long-term neurologic effects that can occur in carbon monoxide.
Is there some kind of test to see what your exposure is?
You can have a carboxyhemoglobin level done in your blood. It's a blood test. And they have the firemen, of course, the paramedics are the ones who usually encounter, they're the first responders for these kinds of situations. And they have little handheld devices that they can do a quick screen if they're at all concerned, and then they can put those patients on oxygen and get them to the nearest emergency room quickly. Okay.
Most emergency rooms don't have hyperbaric oxygen.
No, but they can at least administer regular oxygen, which is better than nothing, while they're waiting to transfer the patient to a hyperbaric facility.
How many are there in the smaller Los Angeles, like from here to downtown, or Santa Monica to downtown?
Okay, so we have a hyperbaric oxygen facility at UCLA. There's one in the, I think, the Oxnard area, but it's only being used for wound healing. It's only open Monday through Friday, and they won't take emergency cases. So we're pretty much, the only other facility that takes emergency cases at all is Long Beach Memorial here in the greater Los Angeles area.
So you're better off to get your own.
Well, it's very expensive.
Neighborhood ones or something.
It's very expensive. Well, we would be very appreciative of any support that we could have to increase the number of facilities that are willing to do emergency treatments. Right now, we see this as a healthcare shortage area where there aren't enough. We get people from Northern California being flown down here for hyperbaric oxygen therapy because the ER doctors, they say they've called 10 facilities between, their Northern California ER and our facility, and none of them were able to take them.
What about all the non-medical facilities that are?
They usually don't work after hours, and of course a carbon monoxide case is usually something that doesn't necessarily occur during regular working hours. Okay, so decompression sickness. This is, scuba diving was something that developed and was popularized in the 1970s. I don't know if any of you remember one of the TV shows that was, was going on at that time. I think it was called Sea Hunt. So we have here, especially in Southern California, we have a large group of people who do recreational scuba diving. But it's also been used, scuba diving is used in military operations, in oceanic research operations. So it's an area which has really expanded over the last 40 years quite a bit. And of course the equipment has improved, and the depths to which people are able to go with their scuba equipment has also increased. Now, one of the things that happens when you get more people doing a extreme sport such as scuba diving is that you're going to have more patients who have potential complications. So one of the complications that can occur with scuba diving is decompression sickness, which what happens is most people who scuba dive breathe air in their tank, okay, and that's perfectly fine. But as you remember, air is a combination of nitrogen and oxygen, okay? What happens is when your body is under pressure, say it's 60 feet below, which is not unusual for scuba divers to go that deep, there are small amounts of the gas that, the air that's in your lungs and the oxygen that's going into your system, so that you actually form very small microscopic bubbles. And there may be bubbles in the lung tissue, and these are not necessarily bubbles that anyone could see under a microscope. They're very, very small. But when the tissues become saturated at a certain pressure, and we all have, our tissues right now are saturated with oxygen and nitrogen, but it's not a problem because we're not changing the pressure. When you're at a certain depth for a certain period of time under higher pressure than you normally would be, and you have all those little microscopic bubbles all over your body, then when you change your pressure or decrease the pressure, say when you're coming back up to surface, those bubbles tend to expand. And that's when you get into problems. And what you can see is you can get pain in your joints from the mechanical stress, okay? And you can also get an inflammatory reaction because your body senses those bubbles as being something abnormal, so it puts white blood cells into the area, and that can cause an inflammatory reaction to occur, which then can also contribute to permanent organ damage. So that's what decompression sickness is. Now, it's not just limited to scuba divers. Tunnel workers, people who are digging a tunnel below the water line, may be at risk for this. And in fact, when some of the tunnels were being built here in LA for our subway, they had a decompression chamber built in so that the tunnel workers, when they came out, would go through a decompression process to prevent decompression illness from occurring in them. And one of the first ways we learned of decompression illness was actually when the Brooklyn Bridge was being built back in the 19th century, because they would bring there were mules being used down in this tunnel that was being built. When they were trying to put the pilings under the water, they had animals and work mules and people down there, and they would bring the work mules back up, and the mules would end up dying. And that was when they first started to realize that working under pressure can cause problems when an animal, including mules, in addition to humans, come up to the surface. Also, airplanes. If you have an airplane that decompresses rapidly, can result in the same problem, because you're going from one pressure to a much lighter pressure. So we have an arrangement with folks up in Edwards Air Force Base, because they do a lot of very high altitude flying there, and they have to actually practice rapid decompression so that if there ever is an accident, their pilots know what to do. And of course, a certain number of their pilots may end up having symptoms of decompression from those controlled practice runs. And so we are the chamber that they come to be treated if that happens. And of course, if you have a hyperbaric chamber and you have patients who are under pressure, it's not so much the patient, but the inside operator who may also be at risk for decompression illness, because every time you put pressure into the chamber, and then when you're done with the treatment and you decrease the pressure, there's a chance that there could be a bubble forming, mainly in the technicians, because the patients are breathing oxygen all the time. The technicians are not.
A high-risk job.
Well, we have to monitor the patients very carefully, and also the technicians, and we limit the length of time of the treatment. So we figure out exactly how long someone can be in, and if it looks like they're exceeding the quote-unquote tables that have been created over a number of years, then we change that inside operator out so he's not at risk for getting decompression problems. So there's no blood test or x-ray or anything that can be used to diagnose decompression illness, okay? You have to take a good history and do a very careful physical exam to pick up the abnormalities. And usually any symptom that develops within 24 hours of scuba diving, you have to assume may be decompression illness until otherwise proven. It could be something as simple as a rash or a joint pain or just feeling crummy. So some of the symptoms are very nonspecific. And if you have someone, just because their symptoms are mild at the beginning, it doesn't mean that they're not going to progress and get worse. So it's very important that even someone who has relatively mild symptoms be considered for possible hyperbaric oxygen therapy. And the goal is to treat them as soon as you've made that diagnosis. Central retinal artery occlusion is also a condition which turns out it is very benefited by hyperbaric oxygen therapy. So central retinal artery occlusion, as you know, your eye has arteries and veins that feed in through the back of the eye to all of the tissues in the eye, along with the optic nerve. And if for some reason you get a little blood clot that maybe, or a piece of cholesterol that broke off from a cholesterol plaque in your neck or somewhere in your heart and traveled up, the eye, if it goes into the artery in the eye, it can cause a blockage and decrease in circulation to the tissues in the eye. Now, if something's small enough in other parts of your body, a little blockage might not cause enough damage for you to be aware of it. But your eye is uses a tremendous amount of oxygen. Your retina uses up 200 times more oxygen per minute than any other organ in your body. So even a temporary decrease in oxygen to that organ can result in permanent damage. In addition to that, if say you had like a little circulation problem, on this part of your hand and part of the skin died, it wouldn't necessarily be the end of the world because you would still have the rest of your hand able to function. You know, you might have a sore there, but you'd have the rest of your hand able to function. If you lose a small part of your eye, that can permanently, you know, I mean, it can be a major problem because your eye is so important and is the only, you know, organ that you have for vision. So again, for...
Your eye doctor would recognize that and say...
Well, this is the problem with this is most people don't understand this. If you notice a painless loss of vision, which is sudden in onset, this is what we call an ophthalmologic emergency. Now, it's just like a stroke. We have patients who say, oh, or a heart attack. We say, oh, I have chest pain. It's been going on for 10 minutes, but I'm not going to go to the emergency room. I'm busy, you know, doing my paperwork at my office, and I have an important meeting I have to go to this afternoon, and I don't want to, you know, interfere with my plans. You know, that's the problem, is that we all have denial. If you end up having some vision problem, your first reaction is to say, okay, I'll wait and see if it gets better on its own. I mean, that's a normal reaction.
Well, I mean, you can't be running to the eye doctor every 10 minutes. What's the
No, but if you lose the vision in one of your eyes, okay? I mean, if it goes, you know, blank, you know, if it goes dark, don't wait. Go call your doctor, and he'll probably tell you to come right over or go to the emergency room. Okay, and then usually they can look in the back of your eye and they can pretty much tell right away whether or not this is a possible problem. And if it is, if we can get you into a hyperbaric treatment, it will allow enough oxygen to get to the retina to be able to keep the retina alive until, you know, whatever they use, blood thinners or whatever, to try to treat the underlying blockage. And a lot of times these blockages will resolve in their own over, you know, a week or so. But by then, the retina's died. So the hyperbaric oxygen is sort of a bridging therapy for these patients. So someone had asked about cost earlier. It's about $500 per treatment, and equivalent to a unit of red blood cells. And I just listed some of the things that we've talked about today. And on average, every patient is different. But on average, it's not unusual for a diabetic to have treatment because usually by the time we see the wounds, they're pretty bad, you know, down to the bone. They require probably a couple months of treatments, Monday through Friday, on a daily basis. A radiation wound, we know that stem cells are not mobilized until you've had 20 hyperbaric oxygen treatments, and those are felt to be very important for radiation injuries. So most radiation patients will end up with approximately 20 treatments. Some of them require more because the wound is very large, but at least 20. For central retinal artery occlusion, because we're just sort of providing bridging therapy until the clot can be busted, is much less. Carbon monoxide poisoning, as soon as we get the carbon monoxide out of the system, then the patient doesn't have to continue treatments, so they require many fewer treatments. And in decompression sickness, a lot of patients, if they only have joint pain or bone pain, they may only require 1 treatment or 2 treatments, but someone who has severe neurologic problems with decompression sickness may require up to 10 treatments. Yes?
After you've paid for the equipment, I can't understand why the costs are so astronomical.
Well, for our chamber, we have a technician, a full-time technician outside. We have a full-time technician inside. For a monoplace chamber, you're going to have a technician watching the outside and controlling the outside of the chamber.
So that's his day job.
Okay, and you have usually that's a nurse or a respiratory therapist or a paramedic that's has had additional training, and you have to pay for the oxygen. For a monoplace chamber, you're blowing in 100% oxygen at a very fast rate, so that's not an inexpensive cost. Plus all the tubing, okay, requires maintenance, and it has to be very high quality for all the piping for these things, because the monoplace chambers have a slightly increased risk of fire because they're filled with 100% oxygen. So they have to have, things. It has to be a specialized type of acrylic that the chamber's made of. It has to be maintained. There's a tremendous amount of maintenance cost with these. And with our chamber, of course, every single fitting has to be checked on regular basis. And we have like what we call a deluge tank, so if there were a fire in the chamber, we can, we have a sprinkler system and we can flood it, because when you have a fire in an area which is under pressure, you have to have the water going in at higher pressure to be able to get it into that chamber. So it's a very, when you have something under pressure, it really magnifies the cost and the complexity of the engineering side of it.
So you feel that you're not making money on them, they're just barely maintaining themselves?
I don't think that this is a profit center. We don't see it as that. It's really, we're providing a community resource. Because this treatment is something that helps people where nothing else has helped them. There's nothing else that is available. There's nothing competing that I can say, well, this is cheaper, why don't we do this? Question?
Yeah, when you mentioned all this special tubing, do you have to be concerned about any sort of bacteria or whatever in these chambers?
You have to be very careful about the humidity, because the humidity might grow bacteria, but our chamber, is, first off, just oxygen tends to kill bacteria. So if you're flooding a monoplace chamber with oxygen, it makes it very difficult for bacteria to grow, and then you try to keep it clean and dry. Just like, if you keep an area clean and dry, the number of bacteria that are multiplying is much less. We do the same thing with our multiplace chamber.
They've got everything masked and cleaned and sterilized and parts replaced
Right.
and all that. So this, you don't have that because you don't have anything to touch your body. You're just laying in there and breathing.
It's topical, yes.
Or you have something over your
Well, it's what we have in our chamber. I think one of the first slides showed a patient with a clear plastic hood, and that's how the oxygen is delivered. So you have a clear plastic hood on. In a monoplace chamber, the whole chamber is in oxygen, so you're just sitting there without a hood or a mask on.
Is that a replaceable thing, or they just sterilize those or whatever?
The hoods, at our facility, the hoods are used for a given patient only. So you have your own hood, it has your initials, and you'll only use that hood. And if it looks like it's wearing out or got dirt on it or anything, it's replaced. And the patients that are in multi-place chambers, they have to wear low static clothes, so we provide them with hospital scrubs because we don't want any static electricity in the chamber. So it's quite a clean environment.
But when these private companies do it, it's different.
The monoplace, I would say if you go to the Undersea Hyperbaric Medical Society and you work with a approved facility, which they have certified as having appropriate safeguards and it being managed appropriately, I would feel that they are as safe as the facility at a university.
Excuse me, how come only head is going to go on there?
Well, if your whole body is under pressure, including the oxygen hood, the oxygen is under pressure as well. So you don't have to have your whole body in oxygen. Just as long as you're breathing in the oxygen, it's under pressure, it goes into the capillaries, and it goes into your tissues under pressure.
I thought when whole body be under the pressure, the oxygen.
No, the oxygen's still going in through the lungs. It's just in a monoplace chamber, the way they were designed was to have the whole chamber under oxygen, but having your hand in oxygen doesn't increase the amount of oxygen your body's getting. It's not absorbed significantly through the hands. It's still being absorbed through the mouth.
And this is new. Before it was only chamber.
The multi-place facilities have been available for years, but because they're very expensive and complicated to manage, most facilities, or if someone has one in their home, they use a monoplace chamber because they're less expensive. Our chamber is set up for treating 18 patients, per session.
Had only chamber. Never had the mask. I'm talking
No,
about
we
11 years ago.
no, we've always had the hoods. Yeah. Now, some chambers use a mask instead of a hood, but the oxygen is not in the entire chamber. It's being delivered, through what you breathe.
When I have at home, I put it in my nose. I mean, that's it.
Oh, we're at questions.
Sure, go ahead.
Are they thinking of other less life-threatening but healing uses for hyperbaric oxygen? I mean, is the reason they don't give it to people who have emphysema, who have to go around with these things attached to their bodies? Is it because it's too expensive, or they don't think it would be effective, or what?
Well, first off, if you have somebody who has emphysema, they have a relatively, compared with the wound that has a very low oxygen level, they have a lesser decrease in their oxygen, so that they're able to supplement their oxygen with something that's portable, a little tube in their nose. Okay, so they're able to be more mobile. If you're having to get your oxygen through a hyperbaric chamber, you're stuck in that chamber for an hour and a half to 2 hours at least once a day, and the effect only lasts about 6 hours, whereas if you have a small portable tube, so there would be no reason to switch people who have emphysema from their portable tube system to a hyperbaric chamber because it incapacitates them more.
You can't heal emphysema, you're just trying
And
to...
it's not
Maintain it.
emphysema is not it's an injury to the lung, but it's not something that, for instance, hyperbaric oxygen would not help it to heal. So oxygen is just supplementing what the emphysema is lost. Question?
This is very frivolous. Why would Michael Jackson want hyperbaric oxygen treatment?
Well, this is a treatment that's been used in a variety of settings, and different individuals have explored various uses for it over the years. In some respects, it's sort of gotten a bad rap because of all of these sort of alternative uses.
Healing kind of
Right.
thing, right.
So that's one of the reasons why at UCLA we limit ourselves to things that have been proved scientifically, okay? Now there may be other things where it's helpful. We've done research, for instance, on autism to see if it would help with autism or cerebral palsy. In England, they use it a fair amount for multiple sclerosis. But in the United States, none of those conditions have been able to be proved scientifically to definitely benefit patients. So those are still not approved diagnoses in the United States.
That's what I was thinking about small fiber neuropathy, because it's just that I don't have oxygen and the nerves are dying off because it's not coming from me.
Right, and that might be a reasonable area to have someone do research on. The NIH does not fund a lot of research for hyperbaric oxygen therapy, so it's an area where it's a challenge because it takes a lot of patience.
What about pneumonia, and also Alzheimer's, where you're not getting enough oxygen through the blood anymore? Wouldn't that be helpful?
Well, Alzheimer's is not necessarily a lack of oxygen to the brain. It can be. It can be a factor, but it's usually over years and years and years that the loss has been occurring before the brain, you have changes in the brain. So that might be a use that might be worth exploring, but we don't have, as far as I know, we don't have anyone doing study on that right now. One of the areas they are using this study right now is the people who are coming back from Iraq and Afghanistan with traumatic brain injury. The Department of Defense has a big multi-unit, multi-site study going on to see if hyperbaric oxygen helps people with traumatic brain injury to heal.
Is that UCLA or over the VA hospital?
They're doing it at, there's a series of sites that the Department of Defense has designated, and one of them I know is in Colorado. I don't know where the other sites are, but they have sites that are dedicated just to this study.
What about lung diseases? Because it kills bacteria. Like I always do deep breathing, hoping that something gets down there, and if there's any bad bacteria, I'll breathe it out.
Well, one of the relative reasons for caution is if You have certain types of lung diseases. Your air sacs may be weaker, so putting them under pressure might be increasing the risk for that air sac to burst. In addition, most of the time people who have respiratory infections, even if they have an underlying lung disease, we can cure those with standard antibiotic therapy. So we would not employ something like this if standard antibiotics were effective.
The stroke patient?
There's been some research on stroke. So far, the data that has been published does not have conclusive evidence that this helps stroke. I do know that I have seen some individual patients who had strokes where it benefited them, so I'm not saying it doesn't work for no one, but the studies that have been done so far have not been able to show a definite benefit. The thinking is that's the next area where research needs to be done.
What about, all of us live in this sort of toxic environment, right? And exposed to a lot of radiation from flying, from X-rays and whatnot else. Something like that, does this, because it's so short-term, would it help with any of that or not?
Well, it won't really help to reverse any damage you might be having from those exposures, because those exposures are they're long-lasting and relatively mild. If for some reason you got a wound that wasn't healing, it probably wouldn't be from the radiation you were getting from the degradation of our atmosphere.
Is there any side effect if somebody going there?
The most common side effect is trouble equalizing the pressure in your ears, because it's like going up and down in an airplane. So you have to be able to move your jaw. Some of the patients have to chew gum, and you may have to go like this to equalize the pressure in your ear. Usually everyone, we can sort of coach everyone to get that to be accomplished. And we can also decrease the rate at which we increase the pressure in the chamber, so it's that gives them time to clear their ears. About 25% of patients may have some blurred vision with this if they have quite a few treatments. And the reason for that is, of course, your eyeball is a relatively soft piece of tissue. Your whole body's being squeezed, under pressure, every time you go in the chamber. Now, what happens is the rest of your bones and most of your tissues, you're not going to notice if, they don't quite go back to their original shape, when you come out of the chamber. But the eye is very dependent on having the sunlight, the light focus in a very specific point in your retina for you to be able to have clear vision. So if the eye doesn't quite go back to the same shape after treatment, you will find that your vision is somewhat blurred. That side effect usually clears up within 2 weeks to 6 months of stopping the treatment. So we do tell people not to go out and buy a new pair of glasses right away. But that's another relatively common side effect. The more serious side effects is people who are under oxygen. It turns out it lowers their seizure threshold. Our brain, all of our brains have a point at which they could have a seizure, okay? Convulsion. You don't have to have a history of a seizure disorder. You don't have to have any other thing contributing to it, but we know oxygen under pressure will cause a seizure in about 1 in 10,000 patients, and we can't predict ahead of time who it might be. What we do to prevent that is we give patients what we call air breaks every 20 to 30 minutes while they're in the chamber, and that basically prevents the oxygen toxicity from occurring in the brain. So those are probably, one of the more serious. Again, if you have an air sac that bursts under pressure, then you could have a collapsed lung from that. And of course, that would be something that would require your being in the hospital overnight and possibly needing a chest tube to re-expand. So those are very rare. We've been doing this since 1997 at UCLA. We've never had anyone who's had a collapsed lung, because if we feel that someone is wheezing or having a lot of mucus, we don't give them a treatment that day, and we address that problem and get it cleared up before they go in and have a treatment. Any other questions? Okay, well, thank you very much. I hope this was helpful.
Thank you.
If you feel allowed to,